Wu Zuanyou, chief epidemiologist at the Chinese Center for Disease Control and Prevention, said on Saturday at an annual meeting that if China's latest measures to ease restrictions had been taken at the beginning of this year, 866,000 to 1 million COVID-related deaths would have occurred on the Chinese mainland in 2022. By November, when China announced its new policies to relax a series of stringent measures meant to monitor and cut the spread of COVID-19, the country had reported over 5,000 deaths caused by this virus. The low death toll, out of a population of 1.4 billion, did not come easily. As many countries tried and gave up stricter measures one after another in the past 3 years, China didn't follow. Over the past 3 years, whenever and wherever there was a resurgence of COVID-19, the local governments attempted to cut off the virus transmission as soon as possible, even though it meant a temporary slowdown of social mobility and economic activities. The country has released and updated 9 versions of the diagnosis and treatment protocol for COVID-19, providing guidance for controlling the spread and timely treatment of COVID-19 patients. On this channel, you'll find all the latest developments from the latest economic news, finance, and investment trends. Subscribe to get your daily dose of money talk. Thanks you. A new edition will be released soon, Zheng Nanshan, China's renowned respiratory disease expert, said last week at a lecture on the fight against Omicron held by the Sun Yat-sen University, adding that the new edition will be conducive to economic development on the basis of active prevention and control of the pandemic. All these measures, based on the latest situation and mutation of the virus, were introduced in order to contain the virus spread in a more science-based and targeted manner, said China's National Health Commission. Chinese researchers are optimistic about the situation, with Omicron being the dominant virus for the time being. Epidemiologist Wu said that the proportion of severe and critical cases of the disease among all confirmed cases in China has dropped from 16.47% in 2020 to 3.32% in 2021. As of December 5, 2022, it was 0.18%. Zhang Wenhong, head of the Center for Infectious Diseases with the Shanghai-based Huashan Hospital of Fudan University, said at a conference that with humans' immune system gradually coming to a balance with Omicron, it was unlikely that a more contagious strain would jump out. In order to better protect this vulnerable group, the plan calls for efforts to accelerate the increase of the vaccination rate among people aged 80 and above, and also to continue to raise the vaccination rate among people aged between 60 and 79. World Health Organization Director General Tedros Adhanom Ghebreyesus said on December 14 that he was hopeful that the COVID-19 pandemic would no longer be considered a global emergency sometime next year. It is a foregone conclusion that China is coming out of this pandemic, and the trend is not going to reverse, Zhang said, but the elderly and other vulnerable groups still need to be properly protected, urging seniors to get vaccinated. The Chinese government has recently released a plan aimed at ramping up vaccination among the elderly population.